I don't know of any patient who wants to lose a body part. And that body part that we're talking about here is the breast. And so all the things we associate with the breast are individual associations and cultural associations and the associations we have with our spouse and all sorts of meeting in our society is referred to the breast. So I'm often asked the question, well, gee, Dr. Harness, how can I avoid a mastectomy? Well, the number one way to potentially avoid a mastectomy is to be working with a team of breast care specialists, breast cancer specialists, who really know the ins and outs of breast conservation, who know the indications, the standard of care when it comes to breast conservation, and who will do everything possible to help you avoid doing a mastectomy. And let me give you a few hypotheticals. Let's say you're even larger breasted, you've got a big area of cancer, you can avoid a mastectomy if your team knows how to do oncoplastic reconstruction with a lift reduction. This is just an example now of the breast as a way of being able to take out more breast tissue and yet preserve the breast. So clearly you want to be involved with a team, and your breast surgeon in particular, that understands the principles and conservation of reshaping the breast. The term for that is oncoplastic reconstruction. The definition of oncoplastic reconstruction also carries over to things like nipple-sparing mastectomy, immediate reconstruction, all the things associated with making you feel whole if in fact you do need a mastectomy. Now, are there circumstances where we cannot in fact avoid a mastectomy? The answer is yes. The answer is the extent of disease that you've come in with, the biology of the disease that you've come in with, a variety of factors that go into the standard of care that may result in a recommendation that, you know what, in your set of circumstances, unfortunately, we cannot avoid a mastectomy. If that's the set of circumstances that you're facing, then like I suggested a moment ago, be working with a team of people that are going to maximize the cosmetic outcome. And there are good indications, as I've shared with on Breast Cancer Answers, for doing nipple-sparing mastectomy, where we're saving all of the skin, the nipple-areolar complex, making incisions down low that are hidden, things of that sort. So if the circumstances arise where you've got multicentric disease, two or more quadrants of the breast involved with cancer, or other similar circumstances, we may not be able to avoid a mastectomy, but we sure as heck can be focused on a really ideal outcome for you that makes you feel whole and good about yourself, what I have called emotional reconstruction. Hi, I'm Dr. Jay Harness, and I want to share with you important information that I believe that every newly diagnosed patient with breast cancer needs to know.
I'm a breast cancer survivor.
I am a breast cancer survivor.
I am a breast cancer survivor.
And I want every woman to know
about personalized breast cancer treatment
and the genomic test.
A test that helps guide a woman and her doctor
to the best treatment options for her.
Pass it on.